In Europe, HPV types 16 and 18 account for around 75% of all cervical cancers. HPV is a small DNA virus which is coated by L1 and L2 proteins. Although most infections are asymptomatic and self-limiting, genital infection by HPV is associated with genital warts and anogenital cancers in both men and women. HPV viruses are classified as high or low risk depending on their association with the development of cancer. Low risk types include types 6 and 11, which cause genital warts and abnormal cervical cytology. Anyone who is sexually active is at risk of HPV. 40% of women can become infected with HPV within 2 years of first sexual intercourse. High-risk HPV infections occur in 29% of women aged 25 to 29 years. The risk of HPV infections increases with the number of sexual partners, the frequency of sexual intercourse, and failure to use condoms. Other risk factors include smoking, a young age for first sexual intercourse, long-term use of oral contraceptives, and co-infections such as HIV, chlamydia or herpes simplex, and a family history of cervical cancer. Most of the public assume that condoms offer full protection from HPV. Whilst they play an important part in protecting us from sexually transmitted diseases, they do not offer full protection. The areas that are not covered by the condom pose a risk to infection. HPV is a double-stranded DNA virus that infects squamous epithelia, including the skin and mucosa of the upper respiratory tract and anogenital tracts. There are approximately 100 types of HPV, with around 40 infecting the genital tract. This diagram shows the structure or surface of the epithelia. Once the HPV virus has penetrated the surface of the epithelia, it goes on to infect the basal cells whilst continuing to grow and reproduce in a replication cycle. In most cases, HPV infection, whether a high or low risk type, is cleared by the body. This is known as transient HPV. The majority of HPV infections are transient and cause no clinical problems. Around 70% of infections will clear within 1 year, and approximately 90% clearing within 2. 10 to 20% will not clear. Persistent infection by a high-risk type of HPV is the most important causal factor of the development of cervical precancerous and cancerous lesions. Persistence and disease is more common for infections by HPV type 16 and 18 than for other high-risk types. For most women, transient HPV will remain asymptomatic and therefore unnoticed. Low-risk HPV types are responsible for genital warts. HPV infection is a risk factor for the development of vaginal or vulval lesions. Around 40% of cases of penile cancer are attributable to the HPV infection. HPV infection has been associated with both precancerous and cancerous lesions outside the anogenital area and also including throat and neck cancers.